Sorry, won't be a moment. Lovely. Yeah, we're live now. Thank you.
Right, thank you. Good evening and welcome to the West Neighbourhood Forum. The forum is made up of elected members of the council. I am Councillor Quinn and I am the chair of the West Neighbourhood Forum. This is a public meeting and as such, this meeting is being webcast to the public. Members of the public watching this meeting can submit questions to the forum throughout the meeting using the form on the right or below the webcast, depending on your device. At the end of each item, the forum will hear questions submitted. When submitting your question, please leave your name and the agenda item or subject matter that your question relates to. Only questions relating to items on the agenda will be accepted. You can find the agenda available to download next to the webcast. The clerk tonight is Natasha Matthews, who will be receiving questions submitted by the public. Thank you. Right, item 1 on the agenda is apologies for absence.
Yeah, so we've had apologies from councillors Anne and Barry Holland, Mike and Teresa Smith and Councillor Naylor, Chair.
Thank you. Item 2 is the minutes. Would somebody like to move them?
I'll move them, Sue.
Right, thank you, Vinnie. Item 3 is the Neighbourhoods forum arrangements. I believe we've got Tom, Councillor Reid, the leader and the chief exec. So it's over to whoever's taken us through this presentation.
Thanks, Sue. Much appreciated. I'll start. Like you said, there's a presentation as well from Tom, and Harry and the leader are also here to share some thoughts as well. It's lovely to be here. And firstly, I'd like to thank Sue, the chair, for being so receptive and allowing us to come along. I think really for a long time we've all talked about the neighbourhood forums and agreed that some change is needed. No matter where you go in the council, it's on everybody's lips, and the potential that is there, not just with the actual forum, but that neighbourhood working as well. And we're really keen to get on this, just get on with it. But following some preliminary research and discussion, it's become clear that the project to renew and improve them is much larger than we first thought. We will still be bringing the scrutiny and full council changes forward for the new municipal year, but this is very much the start of the process for the review of neighbourhood forums. It's about listening inside and out of the council, and we're so keen to capture that. I've already had councillors and officers contact me directly with thoughts on the neighbourhood forums. Certainly the district assemblies come up quite frequently as a previous gold standard model, but clearly, times have changed, budgets have changed, so it's really about how do we make the most of it. The leader's very, very clear on the importance of neighbourhood working, and the commitment to that runs throughout the council with the chief exec as well. We know councillors are the best possible advocates for their communities. Councillors know their residents best, and as I'm sure you've all heard me say in meetings over the past couple of months, it's all about the residents. It's about those residents being at the heart of absolutely everything that we do, and how can we make the council the best possible server of those residents. So that's what we're keen to do. I said last night to the Staley Bridge Forum, nothing's off the table. It's a case of let's make this a success. We want as many voices as possible. There's no red or very few red lines, I'd say, in terms of the art of the possible. But we're just really keen to make this meaningful, to make it work, and to take all the voices included from inside and out of the council. Like I said, the leader and the chief exec are here to share some thoughts as well, but Tom has actually got a presentation for us on some of the discussion points that might provoke some comments even here tonight. Thanks, Chair.
Thanks, Councillor Reid. So I'm just going to share this presentation. So it's based on the document that I think the Councillor Reid shared with the chairs that hopefully has been sent round, but failing that, just in terms of the current model, most of you will know this, but just so that we're all on the same page, currently the neighbourhood forums meet 4 times a year. They are predominantly online meetings, apart from the South, which still meets face-to-face, mostly at different venues. They are public meetings, but online attendees are only really watching a live feed, so they're not meaningfully promoted. So awareness is quite low amongst the public that they even exist. People can submit questions, as you know, in advance or during the meeting, but only a handful really get received throughout the year. So again, it's not a dynamic meeting in that sense. The agendas are decided through conversations between senior leadership team, democratic services, and the chairs. And I think requests for future items can be made at the forums, but they're generally centrally organised. So that there are some limitations to that. So yeah, those centrally agreed agendas are driven. So they end up being much more like consultation exercises about borough-wide issues. There's not as many conversations that you might expect about the local area, the immediate area that you're representing and that you're meeting about. There are also not very many devolved powers or funding to enable you to engage residents or really use that leverage to work with groups, get them interested or motivated to take part in discussions. That really comes with those kinds of powers and funding. And then the resident engagement through forums is quite limited and topic specific. So if there is going to be a question, it's going to be about something very specific rather than something that matters to the whole area. And the resources, so that you don't have a lot of resources attached to them to enable you to do some of this thing. So it's some democratic services officer time, but really not enough of their time to add any value. So again, it's quite limited in that respect. So in terms of a future model, there are an array of options available, and as Councillor Reid mentioned, lots of these are on the table. Even from standing them down completely and not really having any forums, as some areas have done that. With anything from right through to citizen juries and devolving all sorts of powers down to residents and yourselves. And here on the slides, a few examples of the kinds of things that you might see elsewhere that are sort of food for thought, and the kinds of things that you can get out and use these forums for. So real problem solving, devolving that decision making, as I've mentioned, so that members and residents work together to make decisions. Participatory budgeting, so making again devolving decisions on budgeting to residents or attendees of the meeting. Supporting community groups and leaders, consulting with residents and providing information and resources to build knowledge in communities. Ultimately, a lot of this is about increasing that accountability and communication with the electorate. But then ultimately you are problem solving and improving services, and that is obviously the final and where you want to get to ultimately. So put another way, this is the engagement spectrum, where along the bottom you can see the further along you go to the right, the increases the amount of citizen participation. Again, all these methods, right through from just monitoring what's happening in a local area through provision of data, through to the informing residents about what we're doing is not a great deal of citizen participation, but a bit more. Then consulting with them, which is largely what these forums are about, but not through the publics necessarily. Involving them in decision making, and then through to that empowering and really devolving some powers to residents and the communities. So as Councillor Reid said, it's really much a listening exercise. And so it's really helpful for us to understand your views on some of the really big questions at this point. So you can see it on the slide, what are the good and bad about what you have now, and really that what would success look like to you? If we're doing it well, what would be happening? And so, yeah, in a nutshell, what do you want from them? That's it from me. Thank you.
Thank you, Tom. Is anybody else coming in on this presentation, or are we handing it over to the questions?
I think Harry and the leader were keen.
As the leader there, yeah.
Yes, I'm here. Yeah.
Right.
Thanks, Chair. Thanks, Sue. Yeah, I suppose really I just wanted to speak to members about the opportunity that this brings. I know for some time there's been frustrations around the current model, and it really is our opportunity to engage with our communities. I know those of us that are on the call, that I mean, I'm just looking around the room, I think we're all Labour councillors, aren't we? We all share that passion in terms of representing our community. And I think if we look at devolved responsibility as an arm to that, we can really affect our communities positively. So you said we did sort of modelling, but equally listening to communities in terms of who they want to engage with as well, working closer with services like the police, like health, where at the moment it almost feels that they are untouchable. So to some degree, I know we had the Stalybridge Neighbourhood Forum yesterday. There's a lot of nostalgia surrounding district assemblies, which, you know, were great in their time, but certainly ours kind of lost its way to some degree. So some of that would be great again, I'm sure, but that's all up for discussion, I think, and that's why we're bringing it to you this evening. It was one of my commitments when I first came in, because I know members shared their thoughts in terms of wanting a better engagement model than what we've got currently. So hopefully we can offer you something really meaningful out of the back of your engagement and your feedback.
Right, thank you for that.
And Chair, just for completeness, if it's okay if I come in there.
Yeah, that's fine.
Yeah, thank you, and thanks for accommodating us tonight. I mean, you'll probably hear from all four of us that we're really enthusiastic about this review, and we're keen to hear from everybody and make sure all members have got the opportunity to influence the review. It seems to me that wherever I am at the moment, there's a conversation, whether it's in Tameside, in Greater Manchester, or even national, about reforming public services to improve outcomes for residents, and more opportunities and resources being pushed in that direction, including from the combined authority. And Andy Burnham's just took the joint chair of the Integrated Care Partnership with Sir Richard Leese. And the focus is again towards effective neighbourhood working. So we were therefore very clear, and Councillor Reid and the leader made it clear to me in my first couple of weeks, this is a top priority agenda. And I was delighted, because I also believe it really is part of a strategy to improve outcomes for residents. So we thought we need to come and listen and engage, and then embark on a real genuine full review that brings back proposals which take account of the feedback we get from you. So thank you.
No, thank you for that. Right, have we got any questions, or anybody got any views they'd like to put forward? I mean, can I just come in? I mean, Claire, I gather, do you want people, if they don't want to give the full ideas this evening, can members email them over?
Yes, this is the very start of the process, and we've been having some conversations about how to take this forward. We're happy to have input any which way. Like I said, members and officers have already been contacting me. To start the process, we're going to hopefully, if you agree to this, sit down with the chairs, and we'll be having some all-member sessions. But something we discussed in advance of the all-member sessions, we'll ask people to send some views, maybe on a survey, so that it focuses the mind and there's a bit of a discussion point. But you know, we want it to be meaningful, and like I said, you know, this is for all of us, so it's about everybody's voice. So yeah, this is just the very start. If people want to comment tonight, that's absolutely fine, but there will be plenty of opportunity to do so. But thank you very much for the opportunity.
Right, thank you, Claire. Right, have we got anybody wants to come in?
Yeah, we've got Councillor Warrington, Chair.
Councillor Warrington.
Thanks, Chair. Just a couple of things from me. I agree that we do need to look seriously at reforming the neighbourhood forums. They've gone through a bit of a renaissance, haven't they, with from town councils to the town teams, which were a disaster, and to the forums, which are a disaster. I think it is a fact that all the all the different areas, even in district assemblies, you know, going back in history, really operated quite differently, didn't they, from each other? They had different demands, different ways of doing things. And I wonder whether that is still a possibility that each, and I'm presuming we're sticking with north, south, east, and west, but if we're not, let me know, please. But each, let's say, section, if that's what I can call it, has the possibility to do what suits it, because they won't all be the same. They won't all have the same kind of issues. And I think if we're going to attract our residents to turn up and, you know, have a voice, if you like, you know, public voice, then we've got to make sure that what we're talking about is meaningful to them as well. So that's really my question at this stage. Can we develop independently as an area?
Can I jump in there,
Yeah.
Claire? Just to say, I think that's absolutely the scope of where we can get to with it. I think certainly from feedback from other members at the Staley Bridge Neighbourhood Forum, there was question around the construct of the neighbourhoods. So again, that might be part of the conversation where we look at, you know, is it befitting, for example, Mosley into Staley Bridge or Duckingfield into wherever. I mean, it's all on the table, but I think the points that you raise, Brenda, are each of our communities are very different in each neighbourhood, aren't they? And I suppose other than perhaps a terms of reference or wherever we get to in terms of the construct of our forums, it should absolutely be tailored to the neighbourhood and the community. That would be my vision, especially when we're looking at potentially devolving some of that budgetary allowance side of the conversation. But I would, as I say, for me, this is about the scope of the opportunity and members inputting their thoughts and ideas so that we can consider those as part of the offer.
Thank you.
Anybody else?
Yeah, we've got Councillor Jones, Chair.
Councillor Jones?
Thank you very much, Chair. I would definitely agree with everything that's been said so far. I think this is about two things, is it? The neighbourhood forums. It's about locality and it's about engagement. And I think we overcomplicate it. And I think that's what we're actually here to do. I don't actually think when you look at any of the agendas, maybe from the past 12 months, have we actually covered both of those strands in the same meeting, which is a bit of a concern, which is probably why this has come up a number of times. For me, I think there needs to be that strand running through every meeting, and I think there's a number of things there that if we're not ticking the box of it, then it's a bit of a waste of time. I'll be engaging with residents. How are they engaging with us? Could this be a way of residents presenting petitions? Could we have open forums where community groups come and present? Could we have decision notices coming to neighbourhood forums, even if it's just for noting and commenting on? And then those external agencies. I mean, I've never heard from the actual NHS in these forums, I don't think. I think we've also heard from public health, which is great, but maybe not those external agencies as well. And then that locality bit. I mean, the thing I always find frustrating is I find things out about my own ward through reading through papers that are on the cabinet or reading through decision notices, and that shouldn't be the case. I think if it's something that's about my ward and my locality, yes, I want to know. But at the very least, there should be a forum which some of that stuff is discussed. And I think this is all part of that being open and transparent as well, because I think that's where we probably do let ourselves down a little bit in that respect. Because we are open, and all this information is out there, but are we actually discussing it? Is it in an open forum, and do residents see that? So I've got my own ideas, and I'll definitely feed those forward. But I think from my view, it's got to be about sticking to what these forums are meant to be. It's about locality and engagement, and that's got to run through every meeting. And I think that's my main point there. Thank you very much.
Thank you.
Thanks, George. I'm sure no one would disagree with anything that you've said. I mean, this is the whole point. Like I said, nothing's off the table, and it's about it being meaningful, and it's about our the residents. Like I said, councillors know their areas best. But also as well, you know, we've seen that services when they're delivered closer to home, more effective, more engagement, healthier, happier populations. So you know, it's all out there. You know, we appreciate your feedback and look forward to discussing it further.
Right, thank you for that, Natasha. Anybody else?
I can't see anyone else's hands raised, Chair.
Right, can I just come in, Claire? I said, as the chair, I mean, I get frustrated because we don't seem to be going anywhere with the forum, and then after every forum I always ask members, is there anything that you'd like to see on the agenda, and nobody ever comes back with any suggestions. So I look forward to us going through this, because I do feel that it needs revisiting, because as Brenda said before about the district assemblies, when they first started they were great, but then they just sort of died a death, and we need to get the public more involved with these meetings, and they need to know what is actually going on within the council and what we're doing as councillors.
Oh, definitely, and we know, you know, what an absolute advocate Kieran was. Excuse me, I've got a 6-year-old here trying to wave at you, Sue. Like Kieran was an absolute advocate of all of that, and I do remember when when you invited like the dance groups to come and perform at the district assembly, because then you've got the engagement from the parents, and that was absolutely brilliant. You're absolutely right, and I think it's a bit chicken and egg, isn't it? We've all had these frustrations, and you probably more so as the chair, because you're thinking, well, how can I make it better? I'm asking for ideas, but no one's saying anything. Absolutely, and it's a commitment from me, and I know the leader, you know, very, very keen on it. It's so important, you know, and geographically as well, the borders, you know, we can look at that as well, and frequency, everything, to make it real. And obviously you're a key part of that as one of the chairs, and we, you know, hope that you give us your reviews.
Right, oh, don't worry, we will. And I hope all members
100%, yeah.
I hope you get inundated with emails with ideas.
Me too. I'm sure Kieran will be sending his thoughts down.
Right, thanks for that, Claire.
Thank you.
Right, any other questions? No,
nobody else, Chair.
Right, well, thank you for that presentation. Right, item 4 was the police, but unfortunately the inspector's been pulled away, so this item has been deferred till the meeting in March. So we'll now go over to item 5, which is the flu update and the hospital. Over to you, James.
Thank you very much, Chair. And evening, everybody. I think most of you know me. I'm James Malley, and I'm the Interim Director of Public Health at the Council. So I know that the Chair had requested that we bring a quick update this evening just on the flu vaccination programme, and members of the forum will remember that we brought similar updates like this in the past, just really to inform you how that's looking in terms of our flu vaccination programme, but particularly looking at that neighbourhood level data as to how our vaccinations have gone, and the work that we're doing to try and make sure that's boosted to as many residents as possible. So just a very quick presentation from myself to share with members of the group, and I'll run through this quite quickly, because we've also got my colleague Stephanie Sloan with us this evening, who is actually one of our partners working within the NHS and the ICB. Because alongside this, what we do know is we're experiencing quite a bad flu season this year, which is the national picture really. So we're seeing more flu circulate than we have done in the last couple of years. So more people catching it, more people becoming unwell. That's having a real impact on the health system, particularly in the hospital. We have been really pushing the flu vaccination this year. it has been a good match. We sometimes talk about that. So the strains of flu that they've vaccinated for. So what we are seeing is where people have been vaccinated, they might still catch flu, but they've not been getting quite as unwell as they might have done had they not been vaccinated. So that's a real positive, but still work to do. And I think this demonstrates why every year we're always pushing to try and make sure we get that vaccination up as much as possible. Um, just some overview messages, really, I suppose. Just that ongoing point that vaccination for any vaccine preventable disease is really important because it's all about preventing that infection in the first place or preventing how ill people can get. So it's something that we really advocate for. And I think particularly in the winter, all those people who are eligible for a flu vaccine, it's really safe. It's a really effective way of stopping yourself and your family members becoming as ill as they might do. Mentioned COVID vaccinations very briefly. I know many of you will remember many previous meetings where we've been here talking through the COVID challenges and response to that. That vaccination is still offered as well alongside flu vaccinations, and it's very much fallen into that kind of category of those seasonal infections where we do sometimes see spikes in the winter. But as we do know, that does add pressure to the health system. So the more vaccinations we can get out, the better, really. We do work all year round. It's important to mention in terms of locally in Tameside, planning for and pushing out these vaccines, working with our partners in GPs, in pharmacies, working with colleagues like Steph, who's here this evening in the hospital, to really make sure we get that vaccine uptake as high as we can, and we're planning for the impact of that through the winter. I've put a quick summary of the groups who are eligible for the vaccine on this page. And this has changed slightly. So many of you will remember there was a wider group of people eligible for both flu and COVID vaccines when we were in that height of the pandemic and in previous years. And what we've seen now is that eligibility, it's returned more to what we had previously. So you can see the groups here, predominantly people who are over the age of 65, both for flu and COVID, and then those people who are more vulnerable if they've got health conditions. Some of the key groups, though, as well, and some of the ones where we really try to target because we do see lower uptake, is pregnant women and some of our younger children as well. Now, we do have a big program now in recent years, which is rolled out to all our schools. And this, again, is a big Greater Manchester-wide and national push to make sure more and more of those young children are getting vaccinated against flu. And it's partly to protect them, but it's also because we know that that's how infections spread, particularly through young people. So you can see at the bottom there some of the other groups. Now, there were, because of the need to target some of those groups and boost the uptake, some of the programme this year started sooner for pregnant women and for young children. You can see there in September compared to October where some of the other programmes started. And that's actually been a bit later this year than we've seen previously, which was a bit of a national issue. But that's why when I get to some of the data, it's we're slightly behind in terms of where we are now in January compared to this time last year. Again, in Tameside, big push on how we get those vaccines out. And it's about keep trying those different offers that we know can work. In some of the in primary care, in some of the GP practices, and some of the our nurseries, they've tried these flu parties before, where they bring as many, create a bit of an event, try and bring families together to get vaccinated, and make a bit of an occasion of it. That saw a bit limited success really last year. So this year it's been a real focus on just targeted communications, sending messages out to those parents, to those families, and to some of those groups like our pregnant women that we know about, making sure they've got that direct invite and we make it as easy as possible for them to come forward for those vaccines. I think particularly with pregnant women, because that is the group where we do struggle to get the uptake high, and I'll talk through the numbers in a second. We've had a real push through maternity services as well. So having dedicated maternity clinics where that's just there for pregnant women who are coming into the hospital for those checks and those regular appointments to get that opportunity to get vaccinated there and then. So again, it's still a bit of a challenge in terms of getting enough of those pregnant women vaccinated because they are a particularly vulnerable group if they were to catch flu. But it's one of the areas we're really, really pushing. Just to quickly go through the data before I just summarise the final points. Broken this down by neighbourhood. So I know that just says Denton, but that does cover the whole of the west patch. So it's Denton, Droylsden and Audenshaw. And so just highlighted some of the uptake figures we've seen there. Now, the one that's a bit lower is for our care home residents in this patch, and that's one where we do try and push that out as early as we can. So we're looking at that this year to see, how can we try and improve on that figure. But actually, if you look at the uptake we've seen in all these different groups across the West neighbourhood, it's bucking the trend a bit in terms of the figures for Tameside. I mean, as you can see, for a lot of these figures, they're not as high as we would want them to be. And there's a constant push to try and make sure we get to more of those people. And it's about having that conversation, vaccine for flu, it's really important. It's really safe and effective, but also making it easy for people to come forward and do that. We know that sometimes, and since COVID, we have seen a bit of a drop off in vaccination rates. But some of that is not necessarily about people disagreeing with having a vaccine. It's just about making it convenient and easy for them. And finally, just sort of some of those other trends. As I said, since COVID, we have seen a bit of a reduction in our vaccine uptake in general, and I think this just shows compared to this time last year. As I said, it's not directly comparable because we did have that slightly later start nationally this year, but we are a bit behind, and we need to keep that focused work to push those uptake. Just a little bit of information on the COVID boosters there with slightly lower rates, but we're still maintaining fairly a higher rate in our over 65 population, which is the important one. But again, it's really just trying to keep that message alive that these vaccines remain important, particularly with COVID. We're not in the height of the pandemic like we were, but it's still really important and really useful for people to get these vaccines and to keep keep themselves as well as they can do through the winter. So I'll leave it there, Chair. I don't know if there are any questions at this point before we move on to the hospital update.
Any questions for James?
I have a question, Chair.
Brenda?
I've got my hand up. I've got another question, but I think it'll be more suited to Steph, actually. So I'll just go with this one. James, you've not mentioned any ethnic groups, because I do remember sort of especially through COVID and vax in particular, there was a concern that our ethnic groups across Tameside were not really coming forward, and we tried to do a real drive, didn't we, on them? Have we got any information? Because you didn't mention it in your breakdown earlier, and I just wondered whether we'd sort of crack that one, whether they're all just male or female or age groups or what.
Thank you, Councillor Warrington. I'll answer that briefly, and it's a really important point. So for the data we've got for this year, we don't have that breakdown yet, but we will get it. And to be honest, what we do see is we continue to have a bit of a gap. So we do continue to see, sadly, a lower uptake of all vaccinations, particularly the seasonal ones, in our ethnic minority communities. What we do have now, though, and it's recognised in some of the issues that you'll remember from the COVID pandemic, is we have a dedicated stream of funding from NHS England, which it's to support primary care, so our general practices, and we also bring in the voluntary sector so Action Together support this work. To just put in a bit of that extra support to target some of those communities. And it really is about that dual approach of getting the right messages out there and communicating effectively. And sometimes we might have to do that a bit differently. It might be taking messages out into the community, and even the basics, making sure it's language appropriate and it's the message gets across in the right way. But that second point again about making it convenient and easy for people to take up. And it's about getting out into communities more, which is what some of that additional funding does enable our GPs and some of our voluntary sector colleagues to get out there with those messages. So we do still see a bit of a gap, but I think it's the positive there. It's acknowledged in some of the resource we get to try and address that. But I think, sadly, across a number of areas, we still see some of those inequalities for some of those communities. So it's about just continuing to sort of drive at that and make sure we try and close the gaps and address some of those barriers.
Okay, thank you.
Thank you.
Thank you for that. James, can I just mention, I'd like to thank the GP surgeries, because I don't know about anybody else's GP surgery, but mine every other day sends me a text message. You've not had they keep telling me I've not had my flu jab, but I have had my flu jab. So in the end, I got that fed up. I keep getting my text messages. I phone them up to tell them I've had it. So, but give them the due. They're doing the job, and I just hope, because I think they're coming near the end now, aren't they, of the vaccinations for the flu?
That's right, and thank you, Chair. That's a really important message. I'll pass that back. And just to mention on that very last point, so we are towards the latter part of the flu season, but you can still, so we might not have as many of those messages going out, proactively to people, but you can still, particularly from your pharmacy, if anyone, and that message to go out into the community, if anyone hasn't had the flu or the COVID vaccine yet and you're eligible, you can particularly go to your pharmacy. I know they've still got stock, and still get that done even now. So that's another key message, really.
Right, thank you for that, James.
Thank you.
Any other questions for James?
We've got Councillor Axford's got his hand raised, Chair.
Right.
Yep.
Nick.
Hi, thanks for that. Yeah, it's just again about going into the communities. I mean, I've noticed recently there's been a bit of a rise in vaccine skepticism amongst both the COVID and flu vaccine. So when we are going out to the communities and trying to increase take up amongst communities that aren't necessarily wanting to go for the vaccine, is this something that we're trying to combat as well, and just reinforce the message that these vaccines are safe for people to take?
Yes, thank you, Councillor Axford. I mean, it's I think it's something we have to just continually work on and try and get those messages across. One of the most important things with vaccination is just to make sure people have got access to good information, information about the fact that vaccines are safe and effective, and I think the risks of infections like flu that sometimes are a little bit taken for granted, and people don't realise how serious that illness can be. So that work I mentioned, in terms of really pushing out into communities, is part of that. It's only limited. It probably doesn't go far enough, and that's why I think all year really, but particularly in the winter, we try and make sure we get as many of those messages out as possible around the importance of vaccination and making it as easy as possible for people. And we've had a really good test of this, I suppose, in the last 12 months, because some of you will be familiar with the measles outbreak we've seen nationally. And that's been a real cause for concern, because that's resulted from a bit of a drop in the MMR vaccine uptake. And we've done an awful lot of work to try and make sure, the messages around the safety and effectiveness of those vaccines are really out there and getting into communities, so people have got access to that information. But what we did see when we started to really look at the data and the numbers behind that is that we didn't have a lot of people refusing the vaccine or not coming forward for it, but a lot of kids were getting it quite late, so they weren't getting the first dose till they were 5. So that shows me that actually there's a lot of people who want to, they're just not getting around to it because lives are busy and some people face challenges. So again, it's that push on making sure it's as accessible as it possibly can be. So I think it is, again, it's that message of both, making sure that the information's out there and we're getting that to all of our communities, but we're also making it as easy as possible for them.
Right, thank you for that, James. Any other questions for James? Natasha? No? Right. Thank you for that presentation, James. So we're handing over now to Steph.
Thank you, Chair. Yeah, Steph Sloan. I'm the Associate Director of Transformation with the local NHS team in Tameside. So I work closely with James's team and with the local authority on a couple of areas. So I've got a short presentation and an apology that I am completely illiterate with Zoom. So bear with me whilst I try to share my screen. No, so are you seeing that presentation? Yeah.
Yeah.
Lovely. There we are. I've done better than I anticipated already. So James asked me to come along with him here, really just to kind of talking about flu, but also looking at, obviously, again, everybody will have seen in the press the pressures in A&E departments and high levels of attendances. So we just wanted to share a little bit of information really around the position, particularly for December, for the Tameside Hospital, just so that you can see what that activity is like. So thinking about that Christmas and New Year period, which was particularly challenging for the hospital particularly. So you can see there, we talk about the 4-hour standard, which most people will know, but not necessarily. So that is 4 hours from arrival to being seen. And obviously we aim to treat as many people in that time scale. And you can see there the Performance for December 24 was at 62.5% against a plan of 65%, so a little bit behind that plan. And today, up till the 13th of January, when these slides were prepared, January's performance has been at 63% versus a plan of 67.5%. But just thinking about the numbers of people, really, so just a bit more information around that. So type 1 attendances, so we talk in the NHS about type 1 and type 3. Type 1 attendances are those patients that need to be seen in the emergency department, so or A&E, you know, and they might be seen by a doctor, they might be seen by a nurse, because that's to treat either a serious injury or illness. So true sort of A&E type attendances, and you can see there that we're 6.5% more attendances on last year at the same time, and 8.5% on the year before. So for those really poorly people that need to be seen in A&E, quite a significant growth, as you can see. Type 3 attendances, so they are what we kind of call, they might be a doctor, a GP-led service or a nurse-led services. We have them sort of sitting alongside A&E, but it's kind of a community. It can, some walk-in centres are away from EDs, but ours is co-located. So this is the walk-in activity. So there's people that come directly to see a doctor or a nurse for something that's a little bit more minor usually. So that might be minor injuries, so sprains, maybe pulled backs, things like that, or it might be minor illnesses, so things that don't necessarily need to be seen in A&E, and people can access that quite routinely without an appointment. And you can see there that these type 3 attendances are 10% higher on the same time last year and 20% higher than the year before, so really significant increases in activity there. So in terms of there you can see our 4-hour standard. So that standard at the top puts the trust in the 3rd quartile, which means it's in the top quartile, middle, you know, we're in the lower third of the nationally in terms of performance. And a lot of that is about numbers, which I'll show you on the next slide. And just one other point in terms of that, over that Christmas and New Year period. So then part of the problem in numbers in A&E, waiting a long time in A&E, is the number of patients in hospital and able to go home from hospital. So what we also saw was the number of people waiting in hospital who are clinically ready for discharge, the term we use of ready to go home. They might need packages of care, they might need help, but they don't need to be in hospital. That increased over that same period, which stops that flow through the hospital. Now, that's despite lots and lots of work by our social care colleagues to support discharges, and they were hand in hand at the side of us during that period of time, really looking at how they could get people out of hospital and in their own homes as quickly as possible. So just to kind of put into context some of that activity, this shows you sort of the numbers of patients we're seeing. And I remember probably only 5 or 6 years ago that if we got to 300 attendances in a day at our hospital in ED, we'd had a record day. It had been really, really high. And what you can see here is this slide shows you the number of attendances by day, so sort of peak days, the top 10 highest days between 2021 and 2024. And the ones that are shaded kind of a blue colour are all in 2024. So you can see that out of the 10 busiest days overall, 8 of them have been in 2024. So the demand is getting higher. And that's not to say that demand isn't needed. That is, you know, the type 1 attendances are really high there. You can see 400 attendances at our ED for those people that need to be seen in ED, really, really big numbers. So that, you know, that contributes to the challenges we face. A very, very busy ED department. And then, so what do we know about this growth? Where's that coming from? we have what's called the Urgent and Emergency Care Delivery Board in Tameside locality, and we meet on a monthly basis, and that's represented by the hospital, by social care, by our mental health organisation, and by our GPs. So we have everybody there around the table to understand why we have such a busy ED, why more people are coming to the emergency department and treatment centre, and we work on that a programme of work between us. One of the things that we did, some of our GPs in each of the 4 neighbourhoods, in GPs we call them primary care networks, but those are geographically aligned to the local authority neighbourhoods as well, so same areas. So they spoke to some patients. We did a bit of an audit basically that sort of said why that had gone to the urgent treatment centre, so the walk-in activity, to ask them why they'd gone there and whether they'd tried to contact their GP in the first instance. And what on the next slide, I'll just show you what that showed. So we looked at 393 reviews, and what that showed us was that over 55% of those people that we spoke to that had been to the walk-in centre, the urgent treatment centre, had made no contact with any other part of the NHS before going there. So they made a decision to go to the urgent treatment centre without necessarily, and there's other things there that you can see, whether they'd contacted 111, whether they'd contacted the doctor, whether they'd contacted a dentist, it could be other areas. And when we asked them why had they chosen to go to the walk-in centre, again, 50% of that, they assumed that there'd be no practice appointments. So we know we've got some work to do, and one of the work streams that we're working on through that urgent care board is trying to ensure that that patients in the first instance try obviously their general practice, their practice first, but also you know, how do we work with Greater Manchester Comms and things like that to help us get the message out of going to the right place at the right time. What else do we know? We know from that data that we've seen an increase in general practice data as well. And on the next slide, it just shows you a graph which shows you just how much increase there is in primary care. So I know sometimes people think, well, they go into the urgent treatment centre because they've made this decision that they wouldn't get an appointment. But we can show that there's a lot of extra GP appointments as well that are taking place. So what that's telling us is that there is an increase in demand for all of our health services locally. And that's one of the challenges that we're working closely with population health with the local authority, very much around that. How do we work collaboratively to meet that increased demand in urgent care, but also help prevent that urgent care need? So that's just that slide that shows you the yellow line is this year, or 2024, sorry, I'm forgetting we're in 25. So that yellow line shows you the increase pretty much all but 2 months over and above the previous year. The green line is 2023. And then if obviously the orange line is that COVID period of time. But also if we look at there's a dark blue line in the middle, because we quite often think we've never recovered from that before COVID, the activity we used to do before COVID, do we do less of? We can see there that there's quite a significantly more activity now, and this is our GPs, this is GP appointments. There's more GP appointments now. Year on year there's more, but there's particularly we've moved way ahead of pre-COVID pandemic. So just in summary, just on that flu as well, to follow on from James's point, we have had several admissions to hospital for flu cases, but it hasn't been as impactful as in some hospitals nationally. We haven't seen that being the biggest problem of why our hospitals are busy. Our pressures really come from that information I've just shown you in terms of the volume of attendances and admissions and the complexity. So, you know, very poorly people needing time in hospital, but then needing support when they go home as well. So taking a little while to be able to get those patients home. We know from the data that we've just shown that there is more appointments in GPs as well as in more activity going to urgent treatment centres. So it just shows you that, again, all of the activity is going up really. As a system, we work through that urgent care board to try and work together to look at solutions. And there's just a couple of examples there. So the emergency department gets some support from the community services and the community response team to minimise admissions and help get patients home. So they're there at the front door doing streaming or admission avoidance, we call it. So they might say, actually, there's a community service that person can go to instead of going through an ED or getting admitted. So that's already there. We have something called virtual wards. So that's where people need some support and need some monitoring, but don't necessarily need to sit in a hospital bed for that. So they can go home and be admitted to a virtual ward, which is a team of people that will potentially monitor their blood pressure or their observations and things like that from home. And we're able to monitor and observe people using a range of devices. So we kind of have sort of technology that can be people can have in the home that helps us monitor them from home. So there's some of the things that we're doing. Equally, some of our GP surgeries, some of the PCN leads are looking at all the admissions they get from each of their area on a daily basis to see if there's any patterns of who's going there or reasons why they're going there so that they can look to help. And that's it. Thank you very much. Any questions?
Thank you for that report.
Yeah.
Any questions?
Yes, please.
Brenda?
Thank you. Thanks for that, Steph. It brings us up to date, although we still have those issues, don't we? Just two parts to my question, if I may. One of them's about the delayed discharges that I know that yourself and the council have been jointly working on for a number of years now. I wondered whether there might have been any improvement, in the support that the council side of things can give in order to free those beds up. So, really just an update on that. But what I really wanted to ask you about was at the moment, you're saying that things, are pretty bad with particularly the flu. I don't know to what degree COVID comes into that as well. But I'm also hearing that we've got novavirus rampant in the hospital as well. So again, to what degree is that a problem for the hospital? Because obviously it's quite contagious, isn't it?
Yeah.
But I really wanted to know whether we have any escalation of the number, sadly, of deaths as a direct result of any of these viruses over this winter period. What is the state of play there?
We won't have that information yet, Councillor Warrington, because it tends to be a little bit delayed because obviously it goes through that process. I'm not aware of any particularly uplifts, certainly in deaths as a result of those things.
Right. Okay.
Where it does cause us some problem really is again, it's kind of very practical in that when you've got an outbreak of norovirus or flu in the hospital, then you obviously have to isolate.
Yeah.
So either that means we can't admit anybody to that ward if somebody has identified norovirus in a bay where there's more than one patient, or we're always looking for single rooms. So it makes it challenging rather than really increasing numbers. There has been a spike in norovirus over the last probably about 6 or 7 weeks, but not significantly out of line with those usual spikes at this time of year. So and James, I don't know whether that in terms of other areas whether that's circulating as well, but nothing out of line with what you would routinely see at sort of in the winter months when the hospital is very full.
That's right. Just to add to that, thank you, Steph. I mean, so we do see those surges in norovirus typically, and we often, frankly, we do see what we call excess winter deaths, and for these kinds of reasons, because more of these infections do circulate. So while we don't have that data to hand, as Steph's mentioned, at this point in the season, what we know is we do see an increase in deaths, sadly, during the winter for a whole host of reasons, but also linked to these infections. But we do have a lot of Steph's described there some of the processes, both in the hospital, but we do a lot of work with our care homes and some of our vulnerable residents as well. When it comes to that infection prevention and those measures around isolating, around really thinking about how we can stop the spread of those infections. And that is the same for, we have had norovirus, but we've also had, flu and other respiratory outbreaks, less so COVID, to be honest, but other infections do cause us issues as well. But as Steph mentioned, it's not only the impact it has on people who get ill. We try and limit that spread as much as we can, but it's the disruption if we have to do things like stop any new people coming into care homes because there's a bit of an outbreak, or similarly within the wards in the hospital. So it's a bit of both. It's that knock-on impact as well.
Okay, thank you.
Thank you. To answer your other question, Councillor Warrington, in terms of those delayed discharges, so what I'd say is we made huge progress on that. In the last 12 months, we made really, really significant progress. And we used to talk about patients that had been delayed for sort of 80 days. We now only ever talk about patients that have been, well, not delayed, sorry, in hospital for 80 days. We only ever talk about patients now much shorter time, sort of 40 days, 50 days. And we meet as a system every single week. So every Friday morning, the Steph Butterworth and from the local authority and Jonathan O'Brien from the hospital chair a meeting where they go through every patient that has a long stay. Really good information sharing across the two partners to look at, to ensure that from the hospital perspective, a couple of things that we make sure we are start that discharge planning really early, and we challenge each other on that every week in terms of, well, you're only telling us now and we needed to know earlier. And similarly, the hospital, the local authority are looking at what's the need of that person, how quickly can we get a package of care in place, what we do. So we work really, really closely. It has gone up again in the last sort of probably since October time, in part just because of numbers, complexity, the growing demand for the more complex placements, so more patients that need a placement with some mental health support, or more patients that need nursing care and things like that. And that's where we're working together with local authority more long term of what do we need from our local provision, really. But definitely we work really closely together. And actually, quite often, I know that during the particularly challenging week straight after Christmas, the local authority teams were in the hospital, on the wards, really, really looking at how they could support discharge and identifying patients. But we've both got to work together on that as a system because and also the commissioning team in the NHS as well, in terms of making sure we've got the right offers out there. So it's all of us, but we've made really, whilst it's gone up, we've made a lot of progress from where we were sort of 12 months ago.
Right, thank you.
Right, thank you for that. Natasha, any other questions?
Councillor Reid, Chair.
Councillor Reid.
Thanks, Chair, and thanks, Stephanie, for all the work you do. I mean, clearly the digital discharge is an absolute game changer. I was just wondering, in practice, if somebody is they're being monitored at home, at what point would they be discharged from that? Would it be based on the same clinical assessment, or would it be a higher or a lower threshold? Because obviously, it completely changes the dynamic, but it really is fantastic in terms of a way of working and freeing up those beds.
Yeah, there's particular clinical, as you say, assessments that what they kind of do is put some parameters around that say this patient needs monitoring for this. If their position, if their observations are at this, they can be discharged. That's their normal and things like that. And the teams that oversee that that virtual ward, there's a doctor, and then our digital health team are the ones that monitor that on a daily basis. So work really closely with them. So yeah, there's nationally prescribed sort of processes to make sure that it's a safe management, and obviously if that isn't working well, routes to escalation. So digital health can book a patient straight into it's called SDEC, same day emergency care, where they could go on site and have observations done there. They can have interventions done like iron infusions. My mum came for an iron infusion there last week in SDEC, so I can say the service is really good. So yeah, they work together really closely. It is a really good opportunity, and one that the NHS is really kind of looking at to try and support, so that people that are really sat in hospital beds just being monitored every 4 or 5 hours can have that done at home.
So you've got, like you said, like the national standards anyway, and to build that capacity is just incredible. And, you know, it's just obviously caution to make sure everyone's safe.
Right, thank you for that. Any other questions, Natasha?
No further questions, Chair.
Right, Steph, I'd like to thank you for that presentation, and it's been very interesting to listen to what's going on up at the hospital and all the different, you know, like this virtual thing. You know, I didn't know, I wasn't aware of that, so it's very interesting. So thank you.
Happy to come with any updates at future meetings, Chair. So
Yeah,
whatever format.
Yeah, you're more than welcome. Thank you. Thank you. Right, the date of the next meeting is the 20th of March. So I'd like to thank everybody for attending the meeting and enjoy the rest of your evening.